I'm Dr. Brian Berder. I'm here to talk to you today about what I do in my clinic, what I would do for you. So if you're somebody who's experiencing pain of some kind, back pain, neck pain, arm pain, leg pain, what do we do to help you out? Well, we have a variety of treatments, and they start from the gentlest to the most thorough and deepest treatments. And our patients range in age from literally newborn babies to 101-year-olds. So we have the experience and the knowledge. Well, I have the experience and the knowledge to work with everybody and to really do an honest, conscientious effort to get you better. Treatments in the chiropractic world range from activator, which is extraordinarily gentle, and then you have myofascial release and active release, which are the muscular release of nervous tension, muscular tension that's blocking nerves anywhere. You know, you can get a pinched nerve in your elbow, in your shoulder, anywhere in your body almost. So that's what the myofascial and the active release are for. So in our clinic, if you're a new patient, we often start with the gentler therapies, the gentlest of which is activator protocol, which is a handheld device that very gently restores mobility to the segments. And if that's not enough, we can move on to myofascial or active release, where we're opening up the nerves where they may be blocked. And then we have a very special technique in my clinic called flexion distraction. Now, flexion distraction is actually good for reducing tension on the nerves at the spinal level, and it is the only researched technique that can actually restore height to the intervertebral disc, allowing you to go from a compressed or bulging disc to a healthy disc. And we offer that service, and I've been doing that service for over 10 years. Flexion distraction technique, once again, it's very gentle, and it's the only research technique that is shown to be able to restore height and integrity to the disc. So if you have a bulging disc or arthritis in your spine at some level, that would be an appropriate therapy for you. And then for our advanced patients, we have the traditional chiropractic treatments, which they don't hurt, but they are more intimate, they are more aggressive sort of a treatment. They do extremely well with all patients, but we're very gentle with the way we provide the chiropractic adjustments here. The goal being to get you relief. Now, we can get you relief, as I said, from beginning to end, like from the gentlest to the more in-depth aggressive treatments, depending on your comfort. Some patients, they want us to go very, very aggressively, and we can do that. Some people wish we'd be a little gentler. So what's the secret? What do we do? Well, we open up the nerves that are trapped. You might think you have a tight muscle, but if that muscle's been tight for not a day, but for weeks or months, you may have a pinched nerve. Or you might have a plantar fasciitis, but that plantar fasciitis might be a trapped nerve inside of your foot. So we find those muscular entrapments and we open them up. Or, as I said, we use flexion distraction. We find where the nerves are trapped in the spinal levels. And flexion distraction, again, is very gentle. And it's also, once again, the only method known to open up the spinal disc. So we can actually pry open the disc. It fills up with interstitial fluid, and we create a thicker, stronger disc. And then, on top of that, we can also provide traditional chiropractic adjustments, which are extraordinarily effective for restoring symmetry and preventing the degenerative cascade. A final thing that we like to do with our patients, I always bring my patients to a level of knowledge that allows you to have a home care plan that will help you really restore symmetry and strength to your true core, the posterior chain that wraps around and brings movement to the spinal column. So basically, that in a nutshell is what we do for you in our clinic. I'm Dr. Brian Berder. I hope to hear from you soon.